So today's topic is stance and position of the weapon. So first definition we have is gross anatomy, uh, which is the study of body structures you can see with your naked eyes. An anatomical position is when your body is erect, head and toes pointed forward, arms hanging by the sides, with palms facing forward is called anatomical position. We are going to learn these terms, body orientation and direction, and in which we are going to learn superior, inferior, cephalad, ventral, dorsal, anterior, posterior, lateral, medial, proximal, distal, superficial, deep. Uh, Body planes, we have frontal, transverse, sagittal, in which we have median and mid sagittal. Okay, so first is superior. Superior means superior is also called cranial in embryology. It is towards the head end or upper part of a structure or the body above. For example, the head is superior to the abdomen. If this is your abdomen and it is head, so you will say your head is superior to the abdomen. Just like inferior, which is also called caudal in embryological definition. It is away from the head end or towards the lower part of a structure or the body below. Similarly, the navel is inferior to the chin. Navel is your belly button area. Your navel is inferior to the chin. So there is your chin and this is your navel area. Your navel area is inferior to the chin. Ventral. Ventral means interior. Interior means like front, front part. So towards or at the front of the body, in front of. So if I say this is my front, so structures close to the front, these are ventral. Sorry, this is ventral and this is dorsal. Anterior, or ventral is also called anterior and dorsal is also called posterior. So the breastbone is anterior to the spine. If I say this is your spine and this is your breastbone, so you would say breastbone is anterior to the spine. And posterior is the opposite to the anterior, which is towards or at the back of the body behind. So we can say the heart is posterior to the breastbone. So this is your breastbone, your heart is behind your breastbone. So you would say the heart is posterior to the breastbone. Medial. Just imagine we draw an imaginary line in between the body like this, and the structure close to this midline, we'll call it medial structures. For example, towards or at the midline of the body or the inner side. The heart is medial to the arm. This is your arm. This is the midline. So heart is medial to the arm, not here. Okay. Lateral, away from the midline of the body or the outer side. So away means away from the midline, away from this midline, like this. The arms are lateral to the chest. So your arms are lateral to the chest. Intermediate between between a more medial and more lateral structure. Intermediate is like between more medial or more lateral. The collarbone is intermediate between the breastbone and the shoulder. This is the example. Okay, so proximal. Proximal is closer to the origin of the body part or the point of attachment of a limb to the body trunk. For example, the elbow is proximal to the wrist. So this is your elbow. It is proximal to the wrist. So your elbow is close to the body part, is more close to the body as compared to the wrist. So we will say elbow is proximal to the wrist. Distal means away or farther from the origin of a body part or the point of attachment of a limb to the body trunk. This means away from the body. The knee is distal to the thigh. So your knee is distal to the thigh. Means thigh is proximal to the body and knee is distal. Superficial, external, deep, internal. Superficial is towards or at the body surface. The skin is superficial to the skeletal muscle. And deep is away from the body surface or internal. The lungs are deep to the skin. Okay, so we have planes now. We have frontal plane. This is the frontal plane. This is the frontal plane, which divides the body into anterior and posterior. That means it divides your body into two halves, which is anterior and posterior. And transfer section, this is transfer section. It divides your body into two halves, which is superior and inferior, or upper and lower body. Median or mid-sagittal plane. This is the median or mid-sagittal plane, which divides the body into two equal halves, into right and left. Okay, so we have discussed the proximal, distal. Okay, so radial is the radius bone part, ulnar. Okay, we have ulnar and radial bone in the forearm, where the lateral most is the radial. The lateral most is the radial bone and the medial most is the ulnar bone. Tibial, fibular, preaxial border, postaxial border. Okay, so these are the movements. If we take our arm in front like this is the flexion of the arm. And if we take our arm back like this is the extension of the forearm. So if we move forward, if we move forward our leg, this is the flexion of the hip joint. And this is the extension of the hip joint. Similarly, flexion and basically flexion and extension means wherever the angle decreases, it's the flexion, and when we increase the angle, it's the extension. This is the easy example of the flexion extension. If we decrease the angle of the forearm, this is the flexion of the forearm. If we increase the angle, it is the extension of the forearm. Similarly, this is the flexion of the hip joint and extension of the hip joint. This is the extension. We are decreasing the angle of the wrist. So this is the flexion and this is extension. This is the flexion, this is extension. Okay. When we count the fingers, that is called opposition of thumb. And this is the reposition of the fingers. Supination and pronation, abduction, adduction, when we bring closer to the when we bring all the fingers close, that is the adduction, and when all the fingers goes away from the midline, that is the abduction. Okay, so these are the terms we are going to study in the upper and lower limb throughout. This is the tendon of the muscle. This is the belly of the muscle. This is the origin, and this is insertion. Attachment of skeletal muscle. The muscle insertion may take one of the following forms. Tendon, which is a condensed fibrous tissue, example, gastrocnemius muscle. So this is your gastrocnemius muscle, and it is a tendon of the gastrocnemius muscle. Aponeurosis is a flat tendon, example, external oblique. So this is the aponeurosis. Raphe is median tendon, example, malohyoid muscle. So this is the raphe. It's like digitation in between. And muscle fiber themselves is like this, orbicularis oris. Thank you.